Right, hi everyone. Good morning. Sinampuan from Self-Balance, the Acupuncturist. Our topic today is about acupressure point for chest pain. I'm going to my Facebook and share this live video, and as well as share as a watch party so people can just click in. So if you is up on this live video, please say hi to me and type in some hi and send me a love or give a thumbs up, and as well as share this live video. Even though you're watching replay, please share this live video and leave some comment down there. Thank you. And now the next thing I'm going to do is go to my other Instagram account. I have two Instagram accounts. One of them, or three actually, but one is in Chinese. Two of them is actually in English. So I'm going to put in here, and the English one is actually one is my personal one, and the other one is actually my clinic one. So I'm going to put my clinic one is set up. Go to my clinic one, personal one, and there you go. Like this. Do this. Right, hi, happy day. How are you? Right, let's start. Chest pain. Well, we talked a lot about. We mentioned about how to do acupuncture for use acupuncture for chest pain, right? And today the main topic is about acupressure. Again, chest pain can cause from heart, lung, what else? Stomach, gallbladder or pancreas, and it can be muscle or broken bone, or from the upper back, or from the neck, or from the spine and the thoracic spine out of balance that compress the nerve and causing the chest pain. Right? You missed yesterday. Yesterday is still on YouTube. You can get it on YouTube. Yesterday video. Right? Okay. Now today we're talking about acupressure point. Now, yesterday is more about professional. If you are an acupuncturist, then you know what I'm talking about, and you get the strategy, right? But for if you're not an acupuncturist, for yesterday live video, you can okay, this is too much for me, right? And today it's going to be right for you because we're talking about acupressure point. An acupressure point is good for anyone. Now, anyone that if you're an acupuncturist, non-acupuncturist, don't worry. This acupressure point are very easy, so you don't have to be an acupuncturist to be an understand to apply this technique, right? So if you're an acupuncturist, hey, share this with your patient. Okay, when the patient comes, I always give them treatment and as well as show them some acupressure point. But in reality, not everyone will apply this point. But hey, we're there to guide them recover. We're here to guide everyone recover. We're here to encourage and remind our patient to do acupressure point. I explain to my patient in this way. If you come for treatment, please just don't rely on the acupuncture treatment, especially when your symptoms, when your disease, whatever you suffer from, not responding very well, or responding very well and instant relief, and it doesn't last that long, and it only lasts for 4 hours or 24 hours. If you want to make it last longer, if you want to speed up the results and speed up the recovery period, then do some acupressure at home. That's what I mean. So this is something I will show my patient if they want to do it, or even if they don't want to do it, and I'll show them. And if most of the time, if you ask patient, would you like me to show you some acupressure point that you can do at home? and 100% all of them say yes. All of them say yes, but in reality, not all of them will do it at home. So, hey, we're here to guide them, remind them, to show them, to teach them, to give them knowledge and information. And same as here today, I'm going to give you the information today. Now, if you watch my live video previously and you're very familiar those acupressure points that I'm going to show you today. There are some other acupressure point that I'm going to show you today. So this acupressure point, it doesn't matter what causes chest pain. For the symptom, we're talking about for the symptoms. Chest pain is a symptom. We're talking about this symptom. How do you get acupressure point to instant relief chest pain? Now, let's see. In Chinese medicine, we're talking about meridian. And the meridian on the chest, right? We have rod meridian, which is in the middle, right? Then we have kidney meridian, which is over here, right? Then we have what? Stomach meridian, which is over here. And we have as well as, this is called, hang on, let me have a look, spleen meridian and lung meridian. So they're basically all the same line. Same line, okay, from middle to here is about 6, we call 6 chun, right? So that's 4 chun stomach and 0.5 chun that is kidney, 6 chun that is lung and spleen, and as well as what? This one over here is called pericardium meridian, right? Pericardium meridian. Now we have 1, 2, 3, 4, 5. 5 different meridians. Okay, so I'm going to show you some area and some acupressure point, and you can balance all the meridian. So you are not an acupuncturist, and this acupressure point is for everyone. And I want you to understand, once you get this area, the acupressure point done, you're gonna target all over here. Right? If you're an acupuncturist, hey, you can put needle in this acupressure point as well, and it will help with all this. Great for symptoms. It doesn't matter whether it's pain is from heart, the chest pain is causing from stomach, upper back, spine, whatever. Okay, and this treatment is not going to get rid of the root of it. Okay, it may not. It may be. If it's for heart, it may not. But this is just a symptom relief, a pain relief, acupressure point. Now, if you want to get rid of the pain and you want to find out what's causing the pain, whether it's from the heart, from the lung, from the stomach, from the spleen, hey, I would recommend that you go and consult with your acupuncturist and Chinese medicine herbalist or Chinese doctor, okay? Because what we're talking about in here is not about Western medicine. It's about Chinese medicine. Okay? If you're one of my patients, you're on my page, welcome to our clinic. All right, our clinic number is 0784679956. And after 15 minutes, that is a free pre-assessment. So we can assess it for up to 15 minutes. That's free. Get you in and check your pulse, a quick pulse, diagnose, and look at your tongue, and press some point on your back and do some acupressure point and ask you some questions about it and find out whether we can help you or not. Right? Does it make sense? If you're sure that you want acupuncture, straight away book in initial examination. Right? So if you watch this video and you're not my patient, it's too far, hey, go Google it and find out whether there's any other acupuncturist around you and go to them. Okay? Right? Or you can contact me and I may know some acupuncturists around you. Right? Right? Over here, right? We have what name a lot meridian in here. I'm going to show you some point that can target all the meridian. I just sustained fracture on my knee this evening. Oh, that's not good. Happy day. I'm sorry to hear that. Yeah, a fracture. It's not kidding. But acupuncture and acupressure, right? As you're an acupuncturist, um, put some needle and it'll help it heal quickly and faster. Okay. Now, this is what wrist. Look at this. We're talking about image, right? So this is my hand. As you take the puppet show, and this is the mouth. Hi, I'm Sunam, and this is the neck, right? The neck, which means that it can treat the neck. The wrist can treat the neck. This is all head, right? Then over down here, the neck in here, and your chest over here. So your chest over here. Normally the chest over this area. That can treat here. Okay. Now you see, normally what I introduce you is get your hand up like this, 3 finger down here. So over here, there's a level, right? On this level, then use your knuckle to press it in the middle. When you press it in, rub it. If you can feel the tenderness spot, that's the right spot. Okay. Especially you want to press in the middle. If you can feel 2 tendons, and between 2 tendons, press it on. It'll work even better. And when you press harder, you will get tingling in numbers to your thumb or fingers. Okay? So do it right now and press it with me. Okay? Look. 3 fingers down here on this level. In the middle, you find the tendons. And between the tendons, you press it down. And you go press it and go sideways or up and down. Okay? Sideways or up and down. Press it. If it's tender, you go right one. And press it. If it's chest pain, you can press it harder for about 30 seconds or 1 minute. Okay. Then what happened? Go to the side, which is your thumb. The thumb side. So next to the point that you're just pressing on the same level on the thumb side and press it and see whether there's any tender spot. If there is, go for 30 seconds. And go to this other side as well. Right. So here, middle, both sides, then up 1 level. So this was the level. Go up 1 level. If this is on this level, press it down here. In the middle, side, and the other side. In the middle and both sides. Do the same. And on this level, you went up 1 level, right? Go down 1 level. So 3 points as well. This is called what? 3 level, 9 different points, right? 3 level, 9 different times. And this 9 points we call 九宫, 九宫, 9宫, 9宫内关. This is pericardium 6. That if you do this, it can cover all the chest pain over here, all the meridian. Okay, let me show you. For the middle one, we call pericardium. And the pericardium can balance pericardium meridian. Right, this pericardium meridian. So we have 1, 2, 3, 4, 5, 6 different meridian, right? That's me. 6 different meridian. And the pericardium point, it can treat and balance kidney meridian. It can balance pericardium meridian. It can also balance stomach meridian. Okay, stomach meridian, right? So then we do the point on the side over here. This is the lung meridian. And lung meridian can treat lung meridian as well as spleen meridian. Now we have covered 5 meridian. right? And here, the meridian over here, that is called run meridian. And run meridian can be treated by 列缺. If you moved out toward on this point, this one can treat 列缺. Okay, so those two meridian cover all here. But with an extra one over here, you may find it. This is heart meridian, and heart meridian can also balance. What do you call it? This is kidney meridian. Kidney meridian, right? So all these 3 meridian cover all 6 meridian in the chest. Right. So that's pretty simple, right? Pretty simple. Everyone can do that. And if you suffer from chest pain, again, don't worry where it comes from when you use this point. It will all work for you. Okay, it should all work for you. If it works for you, keep doing it. But it doesn't mean you don't have to go and see a practitioner for it, right? This is a home program, and it can speed up the process. When you have chest pain, you do it, it'll give you instant relief. And again, if you get instant relief, and my recommendation for you is keep doing this point every day, even though you're not having chest pain. When you have chest pain, do an extra one. Do an extra one. Okay. Now, this is one thing to do. The second thing that I want to show you is on your leg. Okay. So those points are very easy to do, and it actually easy to apply, and it actually simple. You know, very simple, and you do it every day. And your aim is get rid of the tension spot in here. And whenever you have pain in the chest, apply it immediately. Immediately, right? The other thing, look, this is a door, upside down. What's this? This is the leg. If this leg is hand, look at this. This is the hand, leg, you know. So over here, in the inside of the leg over here, which means it's on the big toe side. You put 4 finger down here. It was 3 finger on your hand, right? So ankle can balance wrist. So 4 finger from the ankle bone inside. So this is another level in here. Again, you do it 3 point. The first point is actually right behind the shin bone. And the second point is back the shin bone. And the third point is actually on the shin bone, right? So 1, 2, 3, and then move 2 fingers above and below. So that's about that big of area. So that big of area, each level, it become about 5 different level. It was 3 level, right? 5 different level, and you have point, and that's 15 point. 15 point. Basically, those 15 point in here, they can cover all here as well. So I'm not going to one by one for you, but because I can't get my legs and show you all this point. But it's a simple thing. Okay, if you don't know how to do this, if you want me to show you, I would happy to take another video for you and show you too. And you leave the comment down there. It basically just 4 finger from the ankle bone, and if it's 4 finger, drop in here this level, and you choose 3 point over here, and the first point behind the shin bone, and the second point another behind the point behind the shin bone, and the third point is on the shin bone. And then you move up 1 finger, 3 point. Again, move up another level, finger 3, and from here you move down 1 and 2. So that become 5 different level. On those level, you choose 3 point. each level, which becomes 15 points. Again, you can either choose this or this, and you can do both. Or if this one doesn't work well, basically, I haven't had anyone told me that this one hasn't been working well. And when you add on this, it just speed up the process even better. So you treat this, it works for you. If you want to speed up the process, or if you press it too hard and you actually overdo it, and you find, oh, I can't do it, but I still have some symptom in there, hey, go for your lead. Okay, so those two strategies are very simple, easy to do. Is all depend whether you have time to do you commit to do it, have you put effort to do it every day or not. Does it make sense? Right? If you have any question, please put it down there and I'll give you the answer. If I do we need video for gout, please? The gout arthritis, you can go for my YouTube, and the YouTube have the gout arthritis acupressure already. Okay, please please go to my YouTube and I show you some acupressure point for those already. And in my course daily life video, I haven't covered gout yet, but previously I showed you how to do acupuncture and acupressure point for gout. All right, stay awesome, and if you have any question, please don't be shy. Leave some comment down there. And let me know whether you enjoy my live video or not. If you do, please write down in there. All right, stay awesome, and I'll see you next time. Bye bye.